Ladies and gentlemen, welcome to this session of the town hall. While we expect other people to join, this is one of the first town hall after our 100th edition. So this is the 101 edition of the town hall. And we consecrated this edition to have a conversation around health system strengthening and using WHO framework. And it's just going to be a conversation that will be preceded by a presentation from our co-moderator, Dr. Brian. So I think, Brian, welcome to the session, and it's exciting to be on the number 101 session.
Yeah, thanks, Elvis, and welcome as well to everyone. I'm really excited to hear that this same model for the Cameroon Town Hall is being looked at, and my goal has really been to see how this model can be implemented in other African countries. I think if we have the same kind of framework, because every African country, or most African countries, have definitely have diasporan healthcare professionals that, and if every diasporan could contribute to some extent to whatever framework, and we will be talking about some of the health system strengthening framework from the World Health Organization. But I think that if every African country diaspora was actively engaged in some developmental initiatives in their home country, I think that will help to promote growth in a very, very great degree. The African diaspora in the United States is so powerful, and so much expertise and knowledge that's here. So I think how to really leverage and bring that expertise back. So I really looking forward to seeing this model being implemented in West African countries, in East African countries, in Southern African countries as well. And I really want to applaud the chair for the town hall for the initiative, for birthing this initiative that has brought together so many other healthcare professionals together to really share their expertise on how we can really help to strengthen our health systems back home. So really excited to hear about Dr. Toka's remarks, and really excited to hear that that's something that he's pushing forward for in other countries as well.
Yeah, especially on a very important subject like peace. Just really, if they can use that approach, that can really be helpful. Let's listen to our chair. Hi, Dr. Mono. Good to see you.
Yeah, Elvis, thank you. And it's always a pleasure getting to meet every fortnight in the town hall. And I'm really excited by the fact that Tucker is using this approach, and others too are getting to use the town hall approach in order for us to foster peace, healthcare, and many other things. So we're proud that people can replicate the ideas we started. I'm particularly very excited about the discussion for today. I hope others will join us. Reason being that healthcare system strengthening is a very important, I think it's one of the pivotal things that we need to really talk about if we want to make change in Cameroon. Because we need a healthcare system which is patient-centered. We need things that are going to be reliable. We need a result-based system. We need accountability. We need cost effectiveness. And we need a way where we're going to do training, curriculum building, and and doctors, nurses, healthcare workers to be able to get to retrain themselves. We will need a system where we'll have monitoring. We need something which is simple to implement in Africa and in Cameroon. And it has to be patient-centered. It has to be result-based. So all of these things, today is really an exciting day for me. When Brian talked about this, I'm a public health specialist, but I've never really gotten into looking into this specific concept of public health, though I've left public health many years ago, but it's very dear to me. So healthcare strengthening, meeting healthcare needs in a population like Cameroon can be very difficult, Elvis. And Brian, I think Brian is going to take us through it, accessing healthcare services, not only to access them, but actually preventive medicine, trying to prevent those who are the population from getting sick. Things like health promotion, where are we in Cameroon? Things like health protection, where are we in Cameroon? All the different building blocks. How is leadership done? Management, governance. You cannot build a good healthcare system without having that. Health financing, where are we getting health financing from? in Cameroon. Those are things I really want us to ponder about and discuss. Human resource. How are we training our human resource? Do we have adequate human resource? Do we have the kind of human resource we need? Are we training the right people? Are we just training doctors and never training nurses and not training others? What is the health inventory? Is it well managed? Infrastructure, do we have the right infrastructure in the right places? And health intelligence, do we have data that can be used in order to drive healthcare systems? So these are all the things that, while I was looking at this topic, I got to reflect about Brian. So it's an amazing topic, really. It's an amazing topic we can talk about for multiple health sessions of the town hall. But thank you for actually getting this for us to really get to reflect about this topic. So over to you, Elvis.
Yeah, thank you very much, Amona. It's a very important topic, and I have the privilege to be aware about the fact that most of the money that was given to Cameroon, I think by the World Bank or IMF during the COVID-19 period to help Cameroon in the fight against COVID, after COVID said was no longer a public health threat, that money was supposed to be used to for health system strengthening, which is still a lot of money. And I think up to this moment, Cameroon still has the money and is still looking at the different ways and approach to translate that funding into health system strengthening. So this might just be one of the great opportunities for us to have a reflection that could be really beneficial for the government to think about how they approach health system strengthenings and what are the pillars they are considering. And of course, I'll be very happy to share this, the policy brief at the end of this session with the different stakeholders that are involved in the implementation of the health system strengthening project in Cameroon. So it's really a relevant topic, and I'm excited to learn about it. But also, when I read the topic again and I saw that we shall be looking at the WHO framework, I'm curious to at the end of the presentation see exactly the interplay between using a framework from WHO and actually using a national-based framework that is unique to a country, that meets the country's needs, and not just one that is prescribed by a multilateral organization. So I would see how those things interplayed into really mapping reality that we face in our different health system, because I think the realities are different in the different countries. The priorities might be a little bit similar, but unique in different ways in different countries. So really exciting to hear. And I know Brian is just the best to take us through the first part of this program, which will be to just go through a presentation that will set the pace for us to have this conversation. So over to you, Brian.
Yeah, thanks a lot, Elvis. Can you see my slides?
Yes.
Okay, awesome. Yeah, thanks. And I think to a great extent, this was inspired from the conversations we had last week. I think Dr. Matt Paul always here also really inspired us about the need for us to conduct a thorough needs assessment, really, of the Cameroon health ecosystem. Really, what are the needs and how can we mobilize ourselves to really fill in some of those gaps? And some other insight from Dr. Kate, I believe will be joining us shortly. Ideas around approaching this from a WHO framework. So we were looking at how really do we integrate the healthcare needs in Cameroon in the context of the World Health Organization's framework for health system strengthening. And I just also want to mention that we have also, and I'll maybe talk about this towards the end of the presentation, is we actually have designed and come up with a survey that will help us to assess what those key questions are, what most of the participants of the Cameroon Town Hall think are the most pressing healthcare challenges in Cameroon, and how can we really work to address those key challenges. So really thrilled for the inspiration. So I really hope that this would just be at least give us some food for thought. I'm not an expert in health system strengthening. I hope that we will use this to really reflect a little bit more about what the key issues and challenges in Cameroon are. Cameroon has, as we know, the health system is very critical component of any country's development. So it's really critical for us to invest. So we're going to discuss a little bit about what those key challenges are, particularly in the context of the challenges, the innovations, and some of the current landscape of the healthcare ecosystem in Cameroon. And I really like to approach this by looking at the different healthcare system strengthening needs, the need to generate data, the need to analyze and diagnose problems within the system, the ability to formulate targeted solutions that will help to address those challenges and to manage and adapt solutions essentially, and to operationalize and implement those changes. So it's one thing to really build the kind of infrastructure that enables us to generate the data, but also we have to really think a lot about the translational aspect of the work as well. How do we operationalize this? How do we implement this? And we've had speakers in the town hall here that have come to speak to us really about the implementation aspect of things. How do we really get data to be actionable in the public in the health system structure? So here's a very brief overview of what the Cameroon health system looks like. At the top is we have public and private in Cameroon, and also traditional providers in Cameroon. So at the very top of it all is the Ministry of Public Health that oversees most of the activities within the health system. And beneath the Ministry of Public Health, we have different regional, what I'd like to characterize as regional delegations of health. And we have beneath those regional delegations of health, we have district health services and other peripheral and other facilities as well. We have central hospitals and general hospitals. This figure is taken from a ministerial document back in 2011. And I know this has been updated quite recently since we've had some additional hospitals in the northern region. So this has been slightly updated. But this is, in general, this is what our health structure, our health system organization currently looks like. So there are really different facets of it. There's a lot of problems that we face in Cameroon. We have the high burden of infectious diseases. Malaria is still a very big problematic issue. HIV/AIDS, TB. And really building the kind of infrastructure for the surveillance of these different infectious disease issues is quite a huge challenge. Maternal and child health issues is still a big problem. As you all know, maternal mortality is a really great indicator of how well a country is doing when it comes to health. Issues with limited access to healthcare services, particularly in rural areas. And still, we have the shortage of healthcare professionals, and most of the healthcare workers, those who really finish from school, most of those prefer to work in the urban setting. So we have a deficit of healthcare providers in the most peripheral hospitals, and also suffering obviously from brain drain. Really, how do we really build the kind of infrastructure that would enable us retain or to retain talent back home? So definitely having a shortage of healthcare workers in Cameroon. So the World Health Organization came up with this framework that really aims to improve health outcomes by enhancing 6 very key building blocks. And I'll be sharing a little bit about what those key frameworks are. I know Dr. Mono mentioned some of those in his introduction, but really give us an idea of what the World Health Organization's framework is, which is essentially a comprehensive overview for sustainable health system development. And there are 6 main components to it. There is leadership and governance, which is critical. The ability to have the kind of effective leadership and governance that's needed at the top, and stakeholder engagement. This is really critical. Healthcare financing is a very important portion of it as well. I know Elvis just mentioned about it, and I hope we can expand a little bit more about funding and how health is being financed in Cameroon and the issues around that, and how do we resolve some of those challenges right there as well. Human resources is another facet to it. Information technology, we are still lagging significantly when it comes to really building the kind of data structure systems or electronic disease surveillance systems that we do need, both within hospitals and within our public health infrastructure systems. Issues around service delivery and access to healthcare, essentially, and also access to quality essential medications or medicines. So it's really the big, the main goals. So I'm going to tackle one of these one at a time, just to discuss a little bit about what those key issues are and where Cameroon is in the context of the World Health Organization's framework. So for service delivery, primary healthcare in Cameroon is provided primarily through a network of health centers and really district hospitals. This is really pivotal to the provision of healthcare services in Cameroon. We have significant challenges in this area of service delivery, including inadequate infrastructure and equipment, particularly in rural areas, but not limited to rural areas. Even in urban areas, we still have significant inadequate infrastructure and the kind of equipments that are needed to provide optimal healthcare. And the recent initiatives are focused really on improving service delivery through community health programs, which I would say is gaining a lot of importance. The importance of really engaging community health initiatives in service delivery in Cameroon is becoming even more critical. And I think engaging community health workers is really I would consider that to be a very viable really option to sustainable development when it comes to health system strengthening. The issue of health workforce development, we talked a little bit about, having, the workforce, but also retaining the workforce. The attrition rate hasn't been really great. So I think there's something that we still have to discuss, particularly in rural areas. Cameroon faces a shortage of healthcare professionals, particularly in the rural areas, and I think there's been a lot of efforts to train and retain the healthcare workers, but unfortunately, the incentives hasn't been really great. How doctors are being paid and the kind of things they can do it's quite a little bit been challenging in recent years to retain this talent in Cameroon. So we're significantly facing a lot of health workforce development. There's this paper that was written a few years ago, just in 2020, where they really looked at the authors of this paper, really tried to examine some of the needs or some of the gaps in the in health system strengthening in Cameroon. And one really key things here they found here really was where the deficits were really, where they were finding where the biggest gaps were. This wasn't done in the framework, the WHO framework for health system strengthening, but they were able to find, or at least to identify some of the key gaps that existed within the system. And you can see in green here, things, the colors really represent the proportion in terms of where the current needs are. So green here, you would see is a proportional representation of where we still have significant, where we have the resources and where we still need a lot of training. And you can see in yellow and in the brown, we have a significant need for training across policies and planning, management, human resources, data needs, and we're going to talk a little bit about data needs later on, the needs for standards and system design, collection and management of individual client data, collection and management of aggregated facility data, data quality assurance, ICT data analysis, etc., etc., etc. So really a great need for strengthening in those areas. So we are significantly lagging in those areas. Really great paper. I would really highly recommend folks to read this particular article. So health information systems critical. Health information systems is really important because for monitoring and really for surveillance purposes, we need to have the kind of surveillance, we need to have the kind of infrastructure that enables us to really measure what's happening within the country in terms of health outcomes. So building robust surveillance programs is really critical. So you have a really good sense of what's happening without data. Really, it's very difficult for us to have a very comprehensive assessment of what the country's needs are. So some of the challenges we have in Cameroon is challenges around fragmented data systems and limited capacity for data analysis. As you all know, many of the records are still being entered in registers and books, and it's very difficult, particularly in the rural areas. I remember back in 2015 or 14, I was working with the CDC's country office. And one of the goals was really, how do we optimize data system for maternal health reporting in Cameroon? And all the data being entered really essentially in registers and books. And we had to work on abstraction, the data abstraction of those data sources in those peripheral facilities. Extremely difficult. And this wasn't even only limited to rural hospitals. It also included the major hospitals, Hôpital Central in Yaoundé, Hôpital HCOP, Hôpital Gynéco-Obstétrique et Pédiatrique de Yaoundé, the general hospitals as well. So tremendous deficits in our data system. So I think these are areas that we need definitely needs a lot of training. And how do we really how do we start revamping the systems, right? How do we build this? There are lots of Cameroonians in the diaspora that are very involved in have the kind of expertise that would be needed to build those kinds of surveillance needs. So how do we get those to work in a specific context? We still have problems or issues with internet access in other areas in the rural community. So those are all things that I really want you all to think in context as we really think about health information systems needs and how do we fix those. Access to medication. I know Dr. Abba-Allen talked a little bit a few weeks ago about the access to targeted therapy, but even essential medications itself is still a big challenge because there are issues with supply chain. There are still issues with the drug essential drug provision facility or institute. I forget the name. I'm trying to recall the name. That's in Yaoundé. That's essentially responsible for the provision of essential medications to all the government hospitals. Really big challenges with that as well. So we really have a deficit in that area, and the need for global fund to help improve access to at least the most vital and essential medications to keep the system running. Health finances, as you all know, in Cameroon, we still rely a lot on out-of-pocket payments by individuals. So I know the minister was here and he really talked a lot about the introduction of universal health coverage, and we had a long debate and conversations around universal health coverage and some of the things or some of the changes that he's made and some of the updates to that as well, which I think is great. I know some people argue that it's really was a redefinition of some of the already existing services in Cameroon, but I really want to applaud the ministry at least for thinking in that direction. I know that universal health coverage, and at least in the framework of the World Health Organization, could really significantly help decrease health the burden in the population as well. International aid and government funding are crucial as well for government for financing health. So that's really critical. Also, want to emphasize how critical it is for us to have visionary leadership, strong leadership and governance for health system strengthening, and the importance of having really the right people at the right place at the right time to provide the right kinds of services. So really critical for us to build policies that address issues around corruption and really ensure accountability within the system. Engagement with stakeholders in a way that stakeholders can really trust what they are really investing their time and energy into. And also the importance of community leaders is really critical. I think the community health leaders are probably one of the most appreciated, probably the most significant influence, people who influence the health system of any country, but probably the most unappreciated because they are really right there with the people, right there at the peripheral level. And I think that figuring out, having ways to engage community health leaders, whether these are religious leaders or policy leaders, at the chiefs and traditional leaders, etc., at the peripheral levels, is really critical for the sustainable growth of any system. Just want to briefly touch a little bit about on the integration of the World Health Organization's framework in Cameroon. So Cameroon has actually begun to integrate the World Health Organization's framework, this framework that I just presented, the 6 frameworks that I just presented, into its health policies. And there've been some success stories as well around maternal and child health, which I think has been great. There's this really wonderful document that was produced by the World Health Organization's country office in Yaoundé that really documented how the integration, some success stories and case studies on how the integration of this framework has helped to some aspects of the health system, notably maternal and child health, but there's also a great need for continuous evaluation and adaptation to improve that. So this is what the World Health Organization country office in Cameroon. I'm sure some of you who've worked in Cameroon, you've probably visited this facility, you've been here for meetings, or I've been involved in one aspect of things going on in Cameroon or the other. But there's this really wonderful document as well. I really would encourage you all to read it. It's really the cooperation strategy between the World Health Organization and Cameroon, that this document that was released in a few years ago to really highlight how how Cameroon is working to integrate some of the suggestions from the World Health Organization's framework for health system strengthening. So I talked a little bit about how the case study for maternal and child health. So I think the focus in Cameroon has really been around prenatal care. As I said, maternal health is one of the indicators of how well a country is doing developmentally. So the emphasis has really been on ensuring that we have access to antenatal care services, particularly in the rural communities, the skilled birth attendants, and also emergency obstetric services. So lots of investment has been done in that area, and I think Cameroon has made tremendous progress in that as well. The role of community health workers in reaching remote areas as well has been critical, and this is primarily because we had a lot of funding we had lots of donors and international funding from Global Fund, etc., PEPFAR, etc., that really helped to enhance some of those to reduce some of the maternal mortality rates, and I think there's lots of success there. But I'm hopeful that some of those successes in this particular program can be redirected to other areas of our healthcare systems as well. Infectious disease has continued to be a problem in Africa and in Cameroon in particular, malaria, HIV/AIDS, tuberculosis, and etc. We've had significant challenges there, but I think that the collaborations with international partners has really helped to improve some of those our controlled efforts. So the challenges are still there, but success stories are providing really valuable lessons. So some innovative approaches to some of the issues in Cameroon. Telemedicine and mobile health initiatives are really helping to improve access to healthcare. We had the presenter of the Gifted Mom project here. I think that was last year. We'll talk a little bit about some of the works that they did with Gifted Mom to improve access to antenatal care for women in rural hospitals, just using the mobile texting services. So that really helped tremendously to improve to improve access. So those kinds of innovative solutions and approaches is really critical. Public-private partnerships may help to leverage resources and expertise and community-based health insurance schemes and really increase affordability. You'll hear me repeating this multiple times, the critical need of community-based health insurance, some sort of like a Njangi that's being done in Cameroon where people can contribute into a and when people are ill. So those kinds of schemes have been successful in other countries, and I think that's one of the approaches that can really help to make healthcare access more affordable in Cameroon. The importance, I cannot underestimate the importance and critical need for key partners, particularly the World Health Organization, the Global Fund, the CDC, UNICEF, etc. I think collaborative projects help to address critical health issues as well. And you can benefit not only from the funding, but also the technical assistance and the capacity building that is critical for strengthening the systems. Community involvement, talk a little bit about this and how critical it is for us to empower local populations with the tools that they need to succeed. So the success really depends on the cultural sensitivity and the local buy-in. I think those are really critical. In 2019, I believe, or so, the Ministry of Public Health came together and they put out this document called the 2020 to 2024 National Digital Health Strategic Plan, where they really tried to emphasize a little bit about how the plans for building in a digitalized health system in Cameroon is, but lots of writings. Again, this is another document I would strongly encourage you all to read. We haven't really seen, this is 2024 coming, we're already in mid-2024. We haven't really seen the kind of vision that they really outline in this document. It's fantastic. I would encourage you all to read it. There's a preface here by the Ministry, by the Minister of Health, who was here in the town hall to talk, but really about some of the priorities and where he sees digital help could help. But we haven't really seen lots of actionable solutions that have come out of this. So a really great document. I would encourage you all to read it. Again, the name of the document is the 2022 National Digital Health Strategic Plan, where they really try to outline some of the goals and how they are trying to redirect some of the priorities for the country when it comes to health systems needs in Cameroon. So highly recommended document. Lastly, before I close, talk a little bit about policy recommendations, the need to strengthen health workforce training and retention, how critical that is, the importance of access to essential medicines through better supply chain and management, increase in health financing, through different funding, innovative funding mechanisms, and the need for better leadership and governance with transparent policies. So those are some of the things that I see as we assess the healthcare ecosystem in Cameroon. And some potential directions that I see is the need to focus on achieving universal health coverage, which I think could be a game changer in Cameroon as well. The importance of investing in health as well. So the importance of investing in health infrastructure and technology and strengthening the partnerships with international organizations and to promote sustainable and equitable health policies. So those are really critical opportunities there. And I think that the Cameroon diaspora can be in a position where you can really leverage some of the expertise in the diaspora to address some of those overwhelming challenges that I've tried to layer out, and sharing really more specifically what the needs in Cameroon are specifically to help lead to the kind of improved health outcomes that we do seek. We have other challenges. We still have lots of challenges with political instability, as you all know, in western regions of Cameroon, north and southern western regions of Cameroon. We have lots of health disparities in our country, which is unfortunate. But there are still opportunities. There are opportunities to leverage technology. There are opportunities for international support and community engagement. And I think those are still areas that I think we can address if we want to really see significant improvements in our health outcomes. So in conclusions, I think that Cameroon's health ecosystem faces significant challenges, but also has great potential. So the World Health Organization's framework for health system strengthening provides a really great roadmap for improvement, and collaboration and sustained effort are key to achieving this better health outcomes. So that's the end of my presentation. And I hope that we will have a chance to have some discussions, really think a little bit more about some of these challenges that are presented, and overlay those with the World Health Organization's framework for healthcare strengthening, so that we can identify very specific gaps that we can tackle in addressing some of the more specific needs that we have in the country. Following our discussion from the last town hall, and if you permit me, Elvis, to just share this, we decided to design a survey to essentially to assess some of these questions that I've shared about what the Cameroonian diaspora thinks is the most critical issues in Cameroon, and really to propose targeted solutions that can help to address those. So we've designed a survey. We have not deployed the survey yet. I believe the survey will be deployed probably within the next few days, and we'll really rely on your support to help share the survey, so we can collect as much information on what folks think are the most critical challenges. Essentially, in the survey, we will try to gather some information about first of all, we want to assess how a situational assessment of the Cameroon Town Hall, and to really have a sense of what people think is working well for the Cameroon Town Hall. I know last week we had a great last 2 weeks we had a great in-depth discussion around some of the things what's working well for the Cameroon Town Hall, what hasn't, and ways in which we can improve. So we are hoping to collect some data points that can be helpful as we rethink around how we can leverage this platform to be most useful, but more especially how the committee that was created by the Ministry of Public Health for diaspora engagement could be most resourceful in addressing some of those. So first of all, the town hall itself, a situational assessment of where we are, a needs assessment of what folks think are the most pressing healthcare challenges in Cameroon. Listed a few, but giving people the opportunity to add any additional elements that they think might be critical to addressing some of those key issues. So our goal really is, again, to really have a great sense to really collect data points that would enable us to know what areas we might want to redirect most of our energy, intellectual energy, and resources towards. And in the page on, it's a very short survey. It will take you less than 3 minutes to fill it up, but it will give us really critical elements. So if you once you receive the survey, please try to share it within your network. It's very anonymous, so we will not know who is filling the survey, but we are hoping that we can collect critical data points that we can, again, bring back to the town hall, share with you all, and let you all know what most people out there are thinking, and how we can really address some of those critical needs that have been identified within the country. So I think with that, I think that's all for my presentation. I want to thank you, Elvis, and thanks to Dr. Mono.
Great. Thank you so much, Brian, for this really excellent presentation and pace center towards the discussion on health system strengthening, and also our upcoming survey. Thank you so much for the work we've done in the background with the chair for coordinating and for your leadership and for our IT team that we work all in the background to make sure that this happen. We, as you heard from Brian, we shall be finalizing to make sure that we deploy the survey this coming week, and each and every one of you will get it in your emails, and we'll be happy as much as we can if you are able to complete the survey. We are really happy for this presentation. I really was interested, really keen on when you dived through the 6 building blocks. And one of those that caught my attention before I hand over to Muno for his comment is that of financing, because when you look at the national budget or state budget or the GDP of Cameroon, and you want to look at how much is spent in healthcare, is less than 4%. As opposed to other neighboring countries, even in Central Africa, that is spend like 6%. I mean, like there are so many other examples of countries that are spending, not up to the 15% that was adopted during, I don't know if it was a Maputo Treaty or which of them, which actually advocated 15% of a state budget to be spent on healthcare. We are not near that. We are not even half that amount, that number. So that explains for a lot of dependencies, right? Especially when you look at the other pillar that has to do with access to essential medicine. When you look at the commodities in healthcare, a lot of commodities in healthcare are procured by Global Fund financing and other international agencies. So the question is, what if there is any breach and they decide not to do so? We're going to suffer. I mean, there are so many of those commodities. I might not want to cite some, but I know that if our international partners just turn their back on us, we're going to go out of stock and no patients are going to die. And then the question is, how much of our own national budget is actually allocated? And how can we start by, what kind of politicians do we send to the parliament? How can people really push their parliamentarians to kind of, fight for a reform in the budgeting such that the healthcare can have a significant amount of the budget and really solve most of this problem of dependency on national or international organizations. So I really kind of was touched when you mentioned the aspect of financing and just how important it is. All the 6 building blocks are important, but that stood out to me in your presentation. So once again, thank you for setting the pace for this conversation. I'll hand over to our chair, Dr. Muno, for your comments before we get to open the conversation to the group.
Wow, Elvis, thank you. And Brian, thank you for your leadership. I'll put it this way very clearly. Your leadership in the town hall, out of the town hall, in the CDC, the drive to end COVID, the drive to digitalize medicine, the drive to get us to the true beyond the 21st century. What you do, you're an essential block in a lot of things. And thanks for designing the survey with your team and everyone who helped you in the background to get this so we can improve. The most consistent thing in life is change. If we can change to the better, that's always going to be good. So thank you very much. And thanks for bringing up this discussion about healthcare system strengthening. This has led me to reflect really, as Elvis said, about health financing, you using the maternal health improvement that has occurred in Cameroon over the past 20 years. I think we're back to where we were in the 1980s. So we've achieved a lot of improvement and taken us back to where we were, and maternal mortality and infant mortality has drastically changed in Cameroon. My question or my reflections are all about health financing really too. Where are we in terms of how are we generating funds in Cameroon? Can we sustain universal healthcare? Have we thought about it this way? Is the government putting its fair share? Are we able to actually tax Cameroonians in such a way that they know exactly how the tax system works? Because general taxation is a big part of it. Like the UK, Germany, a lot of European countries do finance it generally from general taxation. Social health insurance. Is there a way for us to reinstitute social health insurance? When I was in Bamenda, we had things like the mutual funds, we had the Catholic funds, all those kind of things that exist that can actually help people alleviate. How do we finance universal health care? Private health insurances. Just about 2% of Cameroonians have access to that, those who work in big companies and who have their families. out of pocket becomes the biggest thing which people sustain. In Cameroon, maybe if you're diagnosed with cancer, which is what I specialize in, most likely your whole family is going to get poor as a result of that. You need radiation. They want to make one person stay alive. Maybe the whole family is going to get into in-depth poverty. Just say your dad has prostate cancer, you want to get radiation, you want to get surgery, you want to get even Lupron. The other day I was looking at the price of Lupron in Cameroon is almost 500,000 per shot. So you get to realize how much impoverishment we can get into just by someone being sick. Are we in the culture of doing charity donations? Are the wealthy, or is there incentive to even do charity for tax sake? So all these things really give us a big reflection about healthcare strengthening is a big topic. Leadership is important. Management is important. Governance is important. Health financing is important. Human resource, which I have been a big critic in Cameroon. Whom are we training? How are we training them? Do we assess the need? Are we just proliferating medical schools and forgetting about training auxiliary staff that are going to work with doctors? Do these doctors even have support? If you're training a radiation oncologist, are you training physicists? Are you training dosimetrists? Are you training others? So people don't even reflect about how that works. So maybe coming up as usual, maybe a little critic, but these are all things that we need to think about. I just took radiation oncology for one piece. You can't work as a radiation oncologist without having all those things. Do we just have these machines that when they break down, we don't have physicists to fix them, medical physicists? So there is also things like infrastructure, which the government has done a lot. But if you create infrastructure without human resources, it's going to be empty. Health intelligence, do we have enough data to decide how we are going to move forward? What are we feeding data into the system? Is our problem just HIV, tuberculosis, and that? Do we have breast cancer existing in the system that we are not capturing because we don't screen? Do we have prostate cancer killing a lot of our parents that we don't screen? And are they really dying of something else, or do we really know what is happening? So health intelligence is very important that we capture this data. But one of our biggest problems is still procurement and supply chain management. Even when we have all these things, demand forecasting is bad in Cameroon. Product selection is terrible. Budgeting is terrible even to get this. Procurement in the hospitals, shipping, shortages, warehouse, stocking, distribution, and inventory is a big problem. Question is, let's start proposing solutions. Let's start building. I think this topic actually, Brian, I'll tell you this, you got me into going back into my public health books, which I've not done for long. I did a master's in public health, but this was really going back and reflecting how I'm very sad with the number. We usually have a high number of people log into the town hall, but this is a very crucial discussion, and I would love to hear. I see a lot of our eminent professors here who have multiple. There is Professor Welaji, who is here, who has a lot of experience. There is Professor Theodore. There are many of them, and I think I see a lot of other people. I would like to get their input, Wingo and the others. So I would stop talking now, Elvis, and just that it's an emotional topic that I got to reflect about, but thank you, Brian, for giving us this wonderful reflection that we can discuss and spend an hour discussing about. Thank you.
Yeah, no, thank you very much, Chair. And we all agree that it's a very important topic. And certainly we might just, in the couple of months coming, take each of the building blocks and try to delve more on it as to separate topics in the town hall, so we can actually see how we walk through the entire 6 building blocks for health system strengthening, and looking at each of those building blocks and how well Cameroon is doing as a topic on its own, because what Brian did today was just to paint a general picture of the situation. And so you mentioned about supply chain. We all just had the tips of the iceberg during our last presentation when we're talking about access to novel therapy. We could see that our presenter went deep into other commodities that are even basic commodities, and how our own only procurement agency, Sename, has lost credibility to the point where suppliers no longer go in for tenders that are launched by Sename because they don't pay their suppliers. They don't pay their suppliers for years. It can be really, really, really embarrassing for a country to have its own procurement agency lose such credibility to that level where companies run away when you put up a tender. I've never seen that. Companies will always rush to bid for a tender when there is such opportunity. But that just shows us a lot of deficiencies that we have in our supply chain. Even when those things are supplied to Sename, how well do they reach the different hospitals and the people who need them? At times you get these commodities get stuck there for long until they're near expiration before they start rushing to send to the hospital. So these are really very, very serious issues. So, but this is a time for us to open the conversation to the entire audience for comments and questions. And of course, you mentioned, I saw Professor Weleji, who might want to just get his comments on this topic. Hello, Prof. Welcome. You're on mute, Prof. You might want to unmute yourself. Yes, you're on mute now. Yeah, we cannot hear you, but you're on mute, but we cannot hear you. I think Prof has a challenge with his microphone. Sorry, Professor, we cannot hear you. Maybe as you look at adjusting the microphone, we would take, I saw Professor.
Try to click the microphone button on your Zoom and see if there are options to change the specific microphone you're using. You might want to use the microphone for the headset, maybe.
Yeah, unfortunately, we cannot hear Prof. Let's get to Professor Gacho. Some thoughts. Good to see you. It's always a pleasure to see you tune in. I know you are one of those among us who is always in Cameroon and in the United Kingdom, back and forth, and seeing both realities every day.
Thank you very much, Elvis, and thank you all, Cameroon Town Hall, for all what you're doing. I think from all intents and purposes, Cameroon Town Hall is contributing into strengthening the health system, because I think it's a form of educating the population. And as you know, some of the pillars of a good health system is actually the human resources. So education and like forms a real backbone. And I think the Cameroon health system has faced many challenges over the years. And I'm sure most of you who have done public health will know how Cameroon has been trying to chase the WHO guidelines from the how do you call them? The alma mater, is it alma mater?
Alma Ata or something.
Alma mater principles and guidelines, to develop primary health care. Now, I think Cameroon has got all the substrate to have a strong health system. I think our biggest challenge in the Cameroon health system is 1, governance, 2, finance, and 3, education of the public. I think those are important things that we need to look into. Muno, I heard you talking about financing universal health coverage in Cameroon. And there is this drive in Cameroon about universal health coverage. Personally, I think if we try to reconfigure what is happening in Cameroon today, Cameroon already has the foundation for universal health coverage. So I don't think they should be trying to reinvent the wheel. every region of Cameroon is covered by a health district. And every health district is supposed to have a doctor. Every region in Cameroon is covered by a district hospital. And what they need to do is to deliver healthcare using those structures that they have. Now, they must be trying to deliver that. And at the moment, the financing is a big issue. But the government already finances some of that health system, because I don't think what people pay actually goes to pay for the health system, the health service that they receive. So there is already some contribution from the government. I think the government needs to market, needs to communicate to the people what is being done, what is the government contribution. Now, the Cameroon system is designed for a population that has very little understanding of what is going on. But that was in the 60s. 60 years down the line, the Cameroon population has become more intelligent, more educated. I think the government needs to change and start informing people what is going on. The government is doing very good stuff, but the population is not actually aware of it, so they don't see it. I think they need to communicate it to the people. That is one thing that I've actually understood trying to follow up the Cameroon health system. Now, the other thing that that the Cameroon government needs to do is, how do we finance the health system for those people who are needy? And I think that is a very big challenge. I think that is a topic for discussion in another town hall meeting. Thank you.
Thank you very much, Prof. And very, very important contribution there. And when you look at, Muno talked about how can we have a citizen kind of contribution where citizens are taxed to contribute towards a universal healthcare program. And I remember traveling to Zambia last year, and I had to do a transfer of money to one of my colleagues there, and he said he needed his tax ID number. So there, everyone has a tax ID number. So if you're a citizen, you have a tax ID, and it's easy. Not just your ID card number, as in Cameroon, you have a tax ID. If you are to have a bank account, you must have a tax ID, because then the government is able to know where your money is coming from. And if you are doing any form of work where you are receiving any form of payment, you're supposed to pay some tax to the government. So I think in the old days, I remember growing up in the village where when it was tax session, all our grandfathers would run and hide in the hills because they were running away from paying tax. There was some compulsory tax where everybody had to pay. And in the villages, it used to be a very tough time for those who wanted to evade the taxes. They would go to the farm and run away until tax collectors have gone. And I think it was a way of making sure that every citizen pay a fair share of, a contribution to the government. But for now, I think, I don't know what exists again now in Cameroon, but I know most people that are paying taxes are either government workers whose taxes are cut directly from their salary, or maybe someone who is working in an official institution where your salary is declared to send payers. But in the informal sector, there is a lot that is lost from taxes in the informal sector. And I think that could be another conversation, which I think if we want to help those who don't have, as Professor Ngacho mentioned, we have to make sure that those who have contribute a lot to help those who don't have, because that's how it happens here in the United States. And you understand, those who earn a lot of money pay taxes. And then someone who earns less than 30,000 is on Medicaid and goes to the hospital with a good insurance, get all the care, pays nothing. But you who is working, you pay a lot, even just as co-pay when you go to the hospital. And that's just how the system is structured, to take from those who have and help those who don't have. So I think that's a very important contribution, Professor Ngacho. Thanks again for that. I see we have Matt Sandring, and then we'll get Maloba. Over
Thank
to you.
I'm just gonna move my hand. Thank you for giving me the opportunity to talk. I think this is an important subject. We talk about health financing and we talk about governance. I think those two topics or two needs are related. And I want to speak about the issue of governance related to trust. One of the idea, I think, Elvis, you mentioned, and someone before, is using taxation to get the money to finance healthcare. I think I want to take a step back, because in the US, in Canada, the taxation system works. There is transparency where the money flows. In Cameroon, that is not the case. As of this year, the Ministry of Finance has, they actually signed a new law to have a taxation system for all Cameroonian, even people in the informal sector. If you don't actually file your taxes, you won't be able to open a bank account. But in a country where the banking penetration is already low because the banks have outrageous fees, if you ask me if I have an ID to get to open a bank account, I won't get the ID just because I'm going to get a bank account. These are issues. I think I just want for us to reflect on how our system is.
Wow, that's interesting. Thanks a lot, Martha. I didn't even know about that law, and that's new. And getting back.
It's for this year actually. As of I think June 2024, people will have to everyone in Cameroon. They especially target people in the informal sector because they gave examples around people selling on WhatsApp, influencers on TikTok, Instagram, all those people selling donuts because they want to go and then basically get money from everyone. But the money they have today, what do they do with that? I think the taxation system in Cameroon, it's not transparent.
Absolutely.
So even if they get that money from the population, would that go to the health system? Because that's the Ministry of Finance who's going to hold the money, right? It's not going to, I don't know, I doubt that he will actually invite his colleague from the Ministry of Health to share that. So that's one thing. But I want to emphasize on the issue of transparency, because if there is transparency, I don't think anyone will have an issue to donate or to pay his fair share of taxes. And for the people who have, there is always this, I think in the US and Canada, there is this mentality of we take from people who have and we give to people who don't have. I want to say everyone in Cameroon is needy. Someone talk about the cancer, patient with cancer. Even people who have, they have to basically put all the resources to get the treatment. So I think everyone in Cameroon, the way the system is now, everyone is a vulnerable patient. So if you go to a public hospital, even you pay out of pocket to go to a private hospital, you have to spend a lot compared to what you earn. Yes. So I think those two things, governance and trust, are linked. If we want to finance the health system, we need to solve the issue of trust, resolve the transparency issue. And I'm going to end with perhaps an idea on how we can tap into the diaspora. I think the diaspora, I just read the number by the WHO, I think this was WHO and also the IMF, they publish every year around how much the diaspora, the Cameroonian diaspora and even other diaspora in Africa contribute to the economy in Cameroon. And if you just look at the number, it's very high. And if there is a way to basically, I won't say tax those transfer, but incentivize diaspora to contribute, because personally I send money for my parents, and I know many people do as well. So, but if there was a way to channel some of that money, put it in a fund, some kind of a health fund, I think that will solve probably the issue of finance to a certain extent. And the other way also could be basically tax, if we have to go to the taxation road, all those I would say goods which are considered like alcohol, which are not like a necessity for living, right? Consuming alcohol or buying luxury goods. Perhaps that's, if we think about taxation, this is a type of thing that could be put in place, but I want us to be very careful when we talk about taxation to finance a healthcare system, because at the moment, I think the transparency is not there, so people might just feel robbed that one more tax. So I'm going to end there because I can talk more on this subject, but I just wanted to share those thoughts. Thank you.
Thank you very much, Martha. And I will defer this to Brian to just maybe a little expand a little bit or just share his thoughts around the health financing. And because he mentioned about a common bucket kind of financing, traditional insurance financing, and you mentioned diaspora and the role of diaspora. Brian, it would be great maybe to share your thoughts how diaspora can do this, maybe through the Give Back project. How can villages organize themselves into a common basket of kind of traditional insurance scheme, as you mentioned? And also, if you have some thoughts around any use case of a country that has had to tax its population generally in Africa and how well they are doing it. But just a point of correction for Matt, alcohol in Cameroon is essential good because even the artists themselves, they play the music and say, even if you increase the tax, they will still drink. So,
see, I think they can still, they can then tax. This is a good place to start, right? It won't have any effect on the consumption, but there will be money to basically treat those patients when they get sick, right?
Absolutely. Brian, over to you.
Thank you.
Yeah, those were really deep thoughts from Dr. Polo. I think those are really good, and I totally agree. I think we if we have great models of how this has worked in other countries would be great. I don't really have very specific, not an expert on health financing and how to mobilize this, but I think there are lots of countries that have modeled how health financing has been leveraged in a way to improve health outcomes. And there are really great examples of some countries. I could name a few in the developed world, but in other African countries, one of the things that we really need is really how do we really build on the lessons from other countries that have successfully implemented some of those strategies. I think the ideas you propose around financing, whether in Jangi or, some of those cultural and some of the ideas that I think Dr. Polo shared today are really instrumental, but really how do we build those into a more sustainable system for growth in the country? So I really just want to open it back up to people who may have ideas on how health financing. And I agree with Professor Ngacho. I think that is a topic for another town hall if we have to delve into the topic of health financing, and we might need to invite someone who is more specifically specialize or focus on health financing and how we can what we can do specifically in Cameroon to fill those gaps. Obviously.
Thank you so much, and I'll hand it over to Maluba Franklin before we get to Dr. Wingo.
Yeah, thank you once more, Mr. Ives and the Town Hall for giving me this opportunity. Yeah, excellent presentation, Brian. It's always a pleasure being here. Yeah, Brian, I think we are talking a lot about the diaspora, and I think that the diaspora has done a lot. But there's one question that I always think that we always fail to ask. Do we think the government really need the diaspora to help them? I don't know if we have thought of that. Because the diaspora have been doing a lot, and have been asking even for dual nationality, which up to now, the government are not accepted. And to go home, for instance, some of these diasporans need to book visas, which are even refused, but they have business back home. What do you think could be the motivation for them to even go back home to really invest? Do you know how much Cameroon could be missing because these guys could not go home freely to do businesses? Look at other countries like Nigeria. Most of their healthcare stuff are being owned by even the diasporans who can go home freely. And they even try to build this in the community to create a liaison between the community and the health facilities. So sometimes, I don't know if we are hating the government or we don't want to speak the truth. But I think that the government too need to do something to actually welcome the diaspora to do better. That's the first point. The other thing is concerning infant mortality. Brian, you mentioned about the fact that we are improving, yes. But in Cameroon, we still have about 52 children that die per 1,000 every year. And based on healthcare personnel, we have just about 0.8 to 1.2 health personnel per 1,000 patients. How do you think they can do to improve that? Do this really mean something to the government? And every day we get that people want to travel abroad. People are going to Canada. What is the government even still doing to make sure that they don't go? You see? So there are many basic questions that I think that we are overthinking on a bigger picture when there are little pictures there which we should look at to actually come out with concrete solution. So the question we should start to ask the government is, do you really think you need us to help you? If they say yes, then what way do you think you can make this possible for us, the diasporans? Thank you.
Thank you very much, Maloba Franklin. It's always a pleasure to have you in the town hall. Your thoughts are always really tickling, and it helps us expand our thoughts. Thank you so much. If you ask, what is the government doing to make sure that they don't travel? The harsh answer is that they have started seizing the passport of civil servants at the airport, which is a very terrible thing to do. Not the right approach. I think it's not about seizing the passport of a teacher because it's written there, a teacher. Because you think it's a way of avoiding brain drain. The point is to set up a system that encourages them to stay. So I agree with you. And we, at the level of the town hall, you agree, we have had a minister of health here, and when someone raised the issue of dual nationality, he mentioned that it is not in his competence as Minister of Public Health, but then in the committee which he created, bringing in members of the town hall to represent the diaspora in the Ministerial Committee for Diaspora. There is a representative in that committee from the Ministry of External Relations. And I think this has been one of the major conversations they were having there, trying to see how to, for now, since an issue of dual nationality is something that has to go through Parliament, and it's a whole different policy procedure for the country. But in the immediate solution, they are thinking about how they can provide some I think if Samuel and Mona are representing us in that committee, they are thinking about some kind of identification that can help any healthcare professional who wants to go home to be able to get home really without any hurdles, just for the moment, as an interim solution. I think there's a lot of conversation in that direction, which is a step towards the right direction, while pending the big picture, which is a dual nationality, which I think every Cameroonian is requesting for. And it's a whole political issue. The town hall is not really having that capacity to change that immediately, but our voices will continuously be shared through the platform, which is in the Interministerial Committee, and hopefully Cameroonian town hall or healthcare professionals can start benefiting while we think about the entire big picture of other diasporans that are not healthcare professionals, what happens to them. And of course, election is coming next year, 2025. It all starts when people register to vote for elections and put in place people that can do things that they want them to do in terms of policy. So that's what we can say for now, but your points are really important. Maybe I'll give it to Muno if you have some other response to Franklin's concern, especially on child mortality, infant mortality.
Well, Elvis, I will be very brief, but the thing is, Franklin raised some very pertinent points on especially with the diasporans. How do we really want them? Do we really want them to contribute to Cameroon's GDP? And do we really need their money? Cameroon, from the World Bank's report, I think Cameroon contributes about 0.8% of the GDP, which is low, from the diaspora. That may not reflect all of what Cameroonians send in, but that's what is officially reported. Our neighbors, Nigeria, contributes about 7% of its GDP, and Nigeria has a huge economy compared to Cameroon. Egypt, about 8%. So you can get to see exactly that making good policies, instituting good policies that the diaspora can come in and invest, and also can be able to have systems where they can be taxed. The other day I learned from my colleague who is an oncologist too, that Nigeria has a social security system. He wanted to go home. They have dual nationality, and he had to go back now and register in Atlanta to get his social security number. So these are all, and it didn't cost much, but these are all things that we should reflect about. I'm not an expert in this field to decide, but maternal mortality has been something. I'm going to the second question, which I've pondered over for years. Cameroon made a lot of poor decisions in the 1980s, the 1988, where we stopped training midwives. There were so many things, and I always come back to our human resources. Are we training the right human resource to tackle the problems that we have? We stopped training midwives in Cameroon for 20 years. My mother was a midwife, so I know that very well. And we had to come back and reinstate multiple measures in order for us to help fight maternal mortality. That's why my reflection was using health system strengthening framework. What did we do that led to the improvement of maternal mortality or led for us to catch up to where we were back in the days? But these are all things that governance is a big part, as Dr. Polo said. Governance is a very big part of all what we are talking about. And also leadership, management, governance. So it's going to be a difficult thing to just change all of that and different policies that we have in place in Cameroon. So I'll leave it there, Elvis.
No, thank you so much, Muna. And I'll hand it over to Dr. Wingo.
Yes, thank you very much, Elvis. And thank you to all the previous speakers. And I share their views. I think that trying to demonstrate that the Cameroon health system is weak is not anything debatable. The issues now that we are trying to discuss is looking at ways to solve the issue. And from every thing that I've followed here, I think WHO should start thinking about adding another pillar, which to me is politics. Politics is really that on which everything else hinges. We may not really perceive the tremendous impact that politics has when it comes to Cameroon health system. But I think that it is important to realize that some of the politicians that we have today, we don't understand ourselves. The politicians and the public health scientists, the specialists, the researchers, we don't understand ourselves. There's a problem of communication. And probably that plays a role in in hindering mobilization of resources for health. When I look at, and paradoxically for that matter, some of these politicians are former professors of medicine, former professors of public health. And we sometimes want to think that the politician has undressed the professor of public health because the impact of politics is too high. So is there anything that we can probably do about this? And I see here, first of all, capacity building for some of these politicians. Not all of them are specialists in public health. Most of them still need to understand exactly what are the priorities. What can they support in priority to impulse development? And therefore, I look at it and think like we should already look at how can we integrate politics in this WHO framework and see how we can accompany these politicians to better support us in the efforts that we are taking. When we look at most of the strategic plans to fight against diseases, one of their first pillars is what? Political will. But how do you measure political will? How do you influence political will? It's a whole debate that I think we shall probably take a town hall to discuss how we can influence that. The other thing I want to talk about is the workforce. And I want to focus on community health workers. Their role is critical. I mean, we have been shifting more towards curative care. And I feel like our Ministry of Health focuses a lot on curative care at the expense of primary health care, which is the solution, at least for African countries such as Cameroon. So we look at the role that community workers can play, and we feel like it is tremendous. But these community actors do not have a status, for example, in the Cameroon health system. Sometimes some of them are even harassed by the police because they ask them, who are you to transport medication? Who are you to administer medication to people? They don't have a status. And if that can be clarified, that is going to work in the best interest of the health system, because the health map of Cameroon, when you look at it, it is still very undeveloped. We still have areas where there are over 50% of the population that lives above 10 kilometers from the nearest health facility. So we need this help to these community workers to take care to those people. And we don't want to focus on the curative aspect of their work. We want to just focus on that of taking the information, health information, to the people who need them, because there's a lot of ignorance plays also in this. So I will not come to the healthcare workers in the hospitals. That's an old story, and we have all said it here in one way or the other. So I would like to just focus on those two issues to contribute to the discussion here. Thank you.
Thank you very much, Dr. Wingo, for your contribution. Really interesting. You touched the first part, which is politics. And, you know, I always ask this question: what is the motivation when someone wakes up and say, I want to run for office to be a parliamentarian? I always ask, has that person identified a particular issue that they want, that when they get to parliament, they want to see this addressed? Because people should have some motivation before getting to run for office. And when you mentioned that we even have professors who are in some of these positions of influence, ask myself, if you are a medical doctor and you're going to parliament or running for office, and you know that one of the things you want to achieve in your 5 years of office as a parliamentarian is to help pass a bill that will recognize the status of community healthcare workers in Cameroon. If all your mandate comes and that's one thing you were able to do for your country, that will be really, really great. But I think the issue of constituency has really destroyed our parliament, where every parliamentarian goes to the parliament thinking only about his constituency. What do I do for my constituency? Not what do I do for the country? That's why you can count the number of private member bills that go to our parliament. Either if people care more about, the only bill you hear in parliament are those that maybe the head of state want to ratify this thing between Cameroon and this country, just those kind of, large scale policies that don't really have a direct impact on the day-to-day life of people. You want to see parliamentarians really come up with bills that can, for basic things, because most of these things need legislation in order for them to be enacted into law. There's no legislation that backs it, it cannot be. So I think it's really, I really see the important role that politics plays. And it's important to, if our new generation healthcare professionals that are coming up get interest in politics and run for office, with the desire to change something in the healthcare space or in their community, not just run for office to get the prestige of being a parliamentarian. So there is a lot that we can talk about how politics influence this aspect of healthcare system strengthening. But thank you so much, Dr. Wingo. And I really recognize the fact that we can use community healthcare workers to improve healthcare. I've worked in remote areas. I worked in Bakassi Health District for some time, and I know how much of importance community healthcare workers played in those days when we used to enter the flying boats in creeks to go give vaccinations, and I know what that means. So it's really, really important. Thank you. And maybe, Brian, you want to add some more on the aspect of community health, or if not, we can get to the next. We want to try Professor Weleji if his mic is better now, Prof. Oh, we are still unable to hear you. Okay. Yeah, so we are unable to get Prof. I saw Kenji in the house. It's been a while we've not heard your voice, Kenji, but I know you always attend. Maybe some words.
Hi, Evis. Thanks. Hope everyone is doing well. I think it touched on a very great point. I was not there for Brian's presentation, but I think politics, I'll still go back to that, is one key factor that we neglect a lot. And I think, Elvis, you have much experiences in this, having campaigned as a parliamentarian, even though you lost anywhere, but I think you still had some experience in it. I always ask myself, I mean, even when I was in Cameroon, when parliamentarians go to parliament, what do they actually do? Because when I sit like here in the US comparing both systems, we hear that, hey, there is this bill in the Senate, and we know what the bill is all about, and we see people voice their opinions about it. And when that bill is passed, we actually see probably some kind of a change and some things going law. So it's either maybe when I was in Cameroon, I was not informed, or maybe I didn't care anything about the politics. But no matter which type of regulations we put in place, no matter how good it may sound on paper, if that will is not there to ignite it, nothing is going to change. We're going to have this conversation in the next 20 years. And one thing too, I always tell myself, especially in my setting in Cameroon, yeah, Elvis, you rightly said, hey, a medical doctor can go there, and if that medical doctor can do just one thing, that would be great. The thing is a system problem, right? Even when you get into it and you want to make that kind of change, it's like when you are moving towards a positive direction, you are instead the enemy. And I had this one first-hand experience, right? It's like if you don't play by the rules, you are like the odd figure. You are like the end. So it's just like a system thing. And when it is systematic, it's not going to change overnight. It's not going to take one day to change. It's going to take a very, very long time. The politics and the corruption. I had a teacher who was sharing her experience with me regarding, I think it was this pupil, I don't know whether it's a class 5 or a class 4 pupil who had come late. And normally they have to punish those that come late. And the child was like, hey, don't punish me. I have my biscuit in the bag. I'm going to give it to you. Right. At that stage, a child already knows that, hey, I can give my teacher my biscuit from my bag and let that teacher not punish me because I came late to class. So you can already see that this is something that is already, I don't want to say genetically transmitted. That was going to be like an overkill. It's already deep in the system, and my brother Maloba made a very good point. Does the country even need our support, even in terms of healthcare? Do they even want us? Yeah, I know minister have created a committee and all those things. I respect the minister coming to the town hall. But at the tail end, I don't just want this to just be another political strategy because of the issues that have been going on in Cameroon, and all those things, which I don't want to go into so much detail in it. Is this just a way of just camouflaging things, or is there a big wheel here? Again, I don't want to judge the minister. I mean, he's one of the first government officials that has even, taken that stamina to even face people in the diaspora, even give a presentation and a talk, which I think is the first point, right, of people opening up and all. Like, because reason I really want to share Maloba's point is there have been several times that even me have offered my expertise to be able to help in one way or the other, but you just see all this lukewarm attitude, right? Like nobody really cares. But that is something you really need, right? But you don't even care about someone just offering it to you like that. Then I'm like, wow, seriously? Then I have people in Kenya calling me, hey, Dr. Kenya, can you help us with this? That's the same thing I'm offering. I'm instead going to my own colleagues, right? Where I come from, that, hey, let's do this. But it's like maybe, I don't know, it looks like I have some primary aim in it or some primary gain from it and all those things. So this discussion is something that, as one of the speakers said, it's not something we can have in one day. And seriously, if you ask me what the solution is regarding all these political things, I don't know. As I always say, I think I'm a Christian. I think the solution with some of these political things probably is when Jesus comes to be able to help creep it up, because in terms of having this change overnight, it's just so difficult. It's going to take some kind of a revolution, right? And when I talk of a revolution, it's not a revolution of people fighting with guns and all those things. I don't promote that, but a revolution of mind change. And I call that complete transplant of the mindset. That's the only way that we can actually make some kind of moves and some kind of motives. Thank you so much.
No, thank you very much, Kenji, and may Jesus come soon, because the problem is really a serious one and we need solution. Thanks so much for your intervention, and it's really touching to see that you offer your own professional service to your own countrymen, and they take it lightly. Meanwhile, it is highly solicited from other parts of Africa. But we have to continue. We have to continue to do the best we can do. To give back, and that's why the town hall is starting the Give Back project, to see how we can, as diasporans, give back. The first thing, and Maloba, coming back to Maloba's point, is that the government seems to be afraid of its diaspora. That's the first thing, right? There seems to be the kind of some fear of what the diaspora can, and maybe it could be political, or maybe from other experiences that have happened. We've seen how diaspora also has conducted themselves in other countries in terms of the way they treat government officials when they come out to certain countries, and the shameful way in which they treat them. That has created some maybe kind of the gap between the government and how they perceive the Cameroon diaspora, which is wrong, because I think they have to continuously not put everybody in one basket and give a general punishment. We have to continuously, it's a government, and as citizens have the right to complain, and I think they have to look at it positively and see how they can harness this diaspora energy to help improve the healthcare system. The amount of remittances that goes from the diaspora to the country is really huge. I think the figure that is being captured is just those that passes through the bank. There are so many remittances that don't pass through the bank that is not being captured. And if you want to measure all that, it is huge, and it's helping a lot to develop our country back home. So yeah, so I think at this point, I saw Professor Ngacho had his hand up. Maybe he's put it. Yes, Professor Ngacho, we can get you back on.
Yes, thanks, Elvis. I think this issue of giving back to Cameroon from the diaspora is one that is very is actually in the core of every Cameroonian outside Cameroon. I think we are all very proud Cameroonians, but we are actually disappointed with the way certain things happen in Cameroon. There are so many issues that have been voiced from various speakers, from Maloba to Martha Sandrine to Dr. Kenji. And a lot of those things, they've all boiled down to the mindset. And what we realize is that in Cameroon, there is a different way of perceiving things. Cameroon has got a very hierarchical structure, and is a top-down approach in everything in Cameroon. So we have to understand that. And if we understand that, then we can understand how to interact with that system. When we talk about diaspora remittance, I think you made a very clear point that the 0.8% that they are referring to is probably the ones that go through the banks, and they don't actually capture all the remittances that go through the money transfer systems and all the various exchanges that people do in the secondary and the non-regulated market. Now, I am doing business in Cameroon that I want to do the business in a very structured way. So you have a registered company that is registered in all intents and purposes, and you want to officially transfer money to Cameroon. I will tell you, in the United Kingdom, you don't have any official bank that will do a bank-to-bank transfer to Cameroon. So you can now imagine. So if I want to transfer money to carry out a health project in Cameroon, we're talking many millions. That money is not going to be captured. Now, for me to get that money to be captured or to get that money into Cameroon, the regulations are mind-boggling. You need approval from all sorts of places, including the approval from the central bank, to transfer money to Cameroon or to take money out of Cameroon. So all of those regulatory things, some people said the things that we are facing is political. Now, I define health system as an ecosystem. So it is not only things that are in health that affect the health system. Everything in the country, everything affects the health system, directly or indirectly. So if we talk about strengthening the health system, we are just only looking at the tip of the iceberg. So you will need to change the fabric of the country to suit what you are actually wanting to define. Now, I think the way we need to look at this is, how do we use what is in the country and make it better? So I think as diaspora, our biggest challenge is, how do we accept what is in the country and make it better? I think we will win if we go down that route than trying to change what is in Cameroon.
Great reflection there, Professor Ngacho. And you are experiencing this firsthand, and you just touched on something as basic as transfer of money, movement of funds. It's hard for businessmen in Cameroon even to pay their invoices to foreign companies that they are doing business with. To transfer funds out, I've tried it because I did business in the past that had to do with money leaving Cameroon to pay for invoices. It takes almost 3 months in the process for the money to go to the bank, the central bank, and the vetting, and it goes to an intermediary bank in Paris. An intermediary bank in Paris takes it and keeps it for another 1 month before they. It's a big hurdle. And because of that, it's making people to find alternative ways of doing business that is not being captured. And that's why you cannot even measure the volume of remittances in Cameroon. And that's a very big problem. And I agree with you. It's the healthcare system is an ecosystem and affected by every other aspect of the fabric of the political system in our country. So we continue to look at things and our approach has always been in the town hall, every little thing that we can do to change something that can affect the life of 1 or 2 citizens is important. Because if we are looking at how we can completely just change a system, we're always going to get discouraged at some point, but we can always reflect and see what is it, little steps that we can do to change those things that are within our power to change them, and continue to advocate for those that are above our limit. But really, really great reflections there, Prof. And thanks for the example you shared. And I have Wingo's hand is up, and after that we will do a wrap up with the moderators, and then we end the session. Yes, Dr. Wingo.
Thank you again, Elvis. I just wanted to equally look at leadership and governance in health, and to observe that health in Cameroon, most often you see it's a business of the Ministry of Health. I think that we have not succeeded to establish that multi-sector collaboration that is very essential to promoting the health agenda. And centering every intervention of health around the Ministry of Health is very limiting to the system, because it leaves out a whole world of resources that could have contributed to addressing these systemic problems that the health system is facing. When we look at leadership, even on the individual basis, when we do put up leaders in the health system, people are more worried about whether they will keep their position than think about how they can contribute to ameliorate the system. And even when they do think about ameliorating the system, they finally realize that they are working against the interest of other politicians. We come back again to politics. So improving that multi-sector collaboration is critical, it's essential. I remember sometimes even the foreign aid that was sent to the country, even by the Global Fund, had to spend 6 months at the port just because they were waiting for the Minister of Finance to waive the import duty. And it took 6 months while the communities were waiting for these medications to be used to treat them. And just to take that example to show you how that lack of multi-sector collaboration, we have thought, especially in the malaria space, of raising the agenda of malaria to an End Malaria Council, taking it away from the Ministry of Health and taking it to the prime ministerial level, so that he can be able to federate all these sectors, to bring them together so that we can address health issues more holistically. A lot of other external issues that are affecting health. We have climate change. We have conflicts, wars that are all in Cameroon, and they are all affecting healthcare. When we even talk about the diaspora, you see the Ministry of External Relations that has a very big role to play as well. And the minister rightfully said it. It is not really in my place to completely manage the contributions from the diaspora. So multi-sectoral collaboration is key equally to addressing health system issues. Thank you.
Thank you very much, Dr. Wingo, for raising that very important point. Very important, because that's a way we can be able to easily bring other stakeholders. If you think about it, just another example, we have a Ministry of Women's Affairs, and we are talking about maternal mortality. We are talking about breast cancer. But I think if you go to the Ministry of Women's Affairs, that's not their issue. They don't think about it. If you want to think about what is it they are doing as a ministry, even for sensitization, or how are they collaborating with the Ministry of Health to help the women that they are representing, because it's a Ministry of Women's Affairs, but that things that the health of those women are a problem of the Ministry of Public Health. So I really see with you, there's really need to federate some of these issues around the different stakeholders and ministerial departments to have a holistic way of dealing with this. So really, thank you so much for that reflection. At this point, I'll take.
Please, Mr. Ives, there's one thing that we should not let go without even mentioning. I think when it concerns health financing, the communities are doing a lot. Like, for example, like in the case of schools where community do the PTAs to build their schools. And some community have started doing that, where they are contributing to even build some healthcare facilities and even trying to also get some students who have done healthcare studies to actually recruit them in these facilities. I think that should not go by without actually mentioning how the community have been trying to make this possible. Yeah, thank you.
Yeah, thank you very much, Maloba. That's really true. These are great initiative that some communities come together to even recruit. They have what they call village health committees, and they actually recruit some staff in some of these healthcare facilities that are paid by the village healthcare committees or village health councils. So these are just some of the ways in which communities are trying to be, self-reliant in their own way, especially when they are cut off from the main system. So thanks so much for that contribution, Maloba. At this point, I would get some last words from our presenter, Dr. Brian Tegomo, and then we hear some last words from our chair before we close the session. And of course, I'm sure when we will be listening to our chair, he will announce to us the topic that we're going to have next week, now in the next 2 weeks.
Yeah, thanks, Elvis. I think from the reflections and the discussions we've had today, it's clear that this is the topic that resonates very deeply with many of us here, and I think that the many of the contributions that have been shared here has been deeply insightful. So really hopeful that we really take this to heart and continue to really reflect on ways in which we can address some of these issues moving forward. I think the World Health Organization's framework provided us with that I shared provided us with a very comprehensive roadmap on how to think through a collective action to addressing some of these needs, whether it's in leadership and governance or healthcare needs, workforce development, communities. We've heard about the importance of community engagement, the importance of stakeholder engagements and international partners, and how those can make a really significant difference. So thanks everyone for those very thoughtful feedback and contributions. I think those were extremely insightful. So looking forward to the next session.
Thank you very much. Over to you, Mono.
Okay, yeah, sorry. So I just want to start by thanking Brian for presenting this health system strengthening, and also for giving a tip to what our survey is going to look like. And I would like to encourage every participant in the town hall to participate in the survey so we can get to actually improve ourselves and get better. Now, going to the topic for today, this was a very important topic, I think so, strongly, because the question is, are we meeting the health needs of our population in Cameroon? That's my biggest question. Are we providing to them what they need? Are we just providing access to health services rather than providing health promotion and health protection, as Wingo said? The only way in Africa where we can strive to really get good health, like many countries have done it before, like Cuba, is to do preventive medicine. You can achieve better outcomes than the US, as Cuba does, if you invest in preventive medicine. And this is some aspect of health strengthening. Getting into the building blocks, really leadership, management, and governance, which is part of politics, we have identified that could be the strongest part of determining how a health system is going to be sustainable over time, and the interest of the population is taken into account. I think also health financing became a very important part of our discussion today, which we may get to have another session and discuss about this. Human resources is dear to my heart, just because of the way we do use our human resource, how we manage our inventory, how we allocate infrastructure, and health intelligence. I say this all the time because there is transition of healthcare, there is movement of our health, our burden of disease from infectious disease to non-communicable disease. I get a call every single day of someone with a cancer or something, but is that reflected in our policies that we do right now in Cameroon? So I think this was a very important topic. And Brian, thank you. Our next topic, I think, is we're going to discuss the third most common cancer in Cameroon, which is liver cancer. Hepatocellular carcinoma. We'll have a presenter from Cameroon. Hopefully, if there are times that people do cancel ahead of time because of other things, but I'm sure we're going to have a thrilling discussion about that. And also just get to talk about alcohol, hepatitis B, hepatitis C. We have several gastroenterologists in the house, and see how this affects and why hepatocellular carcinoma is very prevalent in Cameroon and what we can do about it. So Elvis, thank you very much for the wonderful moderation as usual, and over to you.
No, thank you very much, Muno. It's been a great pleasure having you all on this session. Thank you for your participation, and I want to exceptionally thank our presenter, Dr. Brian Petegomo, for this really excellent presentation of this very important topic. As you've heard from our chair, we shall be deploying the survey during the week, and we will call on each and everyone to make an effort to complete a survey, because your feedback will be really helpful in informing the town hall on how we move forward. I want to thank Tucker Robbins, our regular member of the town hall, who always will make an effort to attend, despite the fact that he's not Cameroonian, he's American, but he loves Cameroon. He's been in Cameroon for some time, and anywhere in the world he attends the town hall. Thank you for attending the town hall from Morocco now, and I hope you have a nice time in Morocco. Ladies and gentlemen, thank you so much for this, for being part of this session. We look forward to seeing you in a fortnight for another session of the town hall. Have a nice week.